Hello students, welcome to this session, chapter 18, that is universal safety precautions. So one component is respiratory hygiene and spillage cleaning. So we will see in detail this. So what is respiratory hygiene? So while coughing, sneezing, we should use of tissue paper, or we should do it in our inner elbow, so that it is not forming aerosol or droplets and then not contaminating or transmitting that infection to other persons in that area, the hall or the theater, or where the crowded place is there. And then hand hygiene should be done after contact with the respiratory secretions. Cover nose, mouth with mask while surgical mask or N95 mask. So the respiratory hygiene and cough etiquette. So the strategy is targeted at the patients and accompanying family members and friends with undiagnosed transmissible respiratory infection, and then this applies to any person with signs of illness including cough, congestion, rhinorrhea, that is running nose, or increased production of respiratory secretions while entering a healthcare facility. So if anyone is having symptoms like cough, sneezing, or sputum production, then that person should take precautions. So what things they should know in cough etiquette? So the education of healthcare staff, patient and visitors should be they should know about the respiratory hygiene. Then they should cover the mouth or nose with tissue or cloth while coughing and sneezing. Then hand hygiene after contact with respiratory secretions, they should maintain distance minimum more than 3 feet for respiratory infection in common meeting areas. Then mask should be provided to coughing patients. Then healthcare personnel are advised to observe droplet precautions, that is wearing mask, hand hygiene while examining the patient. Then they should be advised to avoid direct contact with the patient, especially high risk patient, and then they should wear mask while taking care of the patient. So here this is a good practice for the respiratory hygiene. So when coughing or sneezing, cover your nose and mouth with a tissue paper or handkerchief. Then you can also cover your nose with your bent elbow to stop the spread of the virus, that is respiratory secretions which are forming aerosols or droplets. Then after using the tissue, dispose of it in a waste bin. Decontaminate your hands with soap and water or alcohol sanitizer. Then the second part is spillage cleaning. So in spillage cleaning, you should wear gloves and gown. Wipe up the spill immediately with absorbable material. Wipe that area with 10% sodium hypochlorite. Then remove your PPE and perform hand hygiene. So in spill kit, what things should be available in high risk area like laboratory, sample collection room or wards? So in that for blood, the PPE should be there of gloves, apron, mask, shoe cover and eye protector. Then absorbent material like newspaper or blotting paper, tissue paper should be there. Then water collection bag should be there. So waste collection bag should be there. Then scoop and scraper, disposable forceps, buckets, mops and signage board for the no entry till you remove that spillage. So this is a steps for the blood or body fluid exposure spillage. So in that, keep signboard first, then wear PPE, cover it with piece of paper or absorbent cloth, then pour 1% hypochlorite solution on the spill. Then for major spill, wait for 30 minutes for the action of disinfection. For minor spill, you can wait 10 to 20 minutes. Then wipe the area in a circular manner and put the collected material in a yellow cover bag. Mop the area with disinfectant. Send the incident report form to infection control nurse. So here this is a good practice for the respiratory hygiene. I hope this session you will find useful. Thank you.